All right, well, I'm back. I'm going to talk about hooking up a non-rebreathing system. We talked about the rebreathing system with the circle system on part one. So I'm going to go really quickly through here how the machine is set up. So this is the oxygen tank, and then it's carried through the yoke, into the pressure gauge here, which again is at 500, which is very low. It needs to be filled. And then it goes through here, green hose is oxygen, to here, which, I'll flip it around this way, is right here. And this is the flow meter where we turn this up to the flow that we want. 1, 2, 3, 4, whatever, usually closer to 1 or 2 liters per minute. And then from here, it comes out. Here's the top of the flow meter. Here, the oxygen exits here, comes around to the vaporizer where it picks up the anesthetic gas, isoflurane in this case, comes out here, saturated with gas, or through the oxygen that is picked up the vapor of the anesthetic, comes out here to here, and this is the start of the circle system. If you want to bypass the circle system, what I'm going to talk about here is, that was my scavenger system, we'll hook that back up. If we want to bypass the circle, which is what we want to do with a non-rebreathing, we skip this where it's attached into the circle. We don't want that. And again, this Y here comes from the O2 flush valve. Oh, there we go. I flushed a little bit of O2 through there. So what we do is, here is my non-rebreathing system. And this is the oxygen plugged into there, right, like yay. We plug that in, that's our oxygen, and it's going down here, right to here, and then right here, at the tip here, is where we plug this into the endotracheal tube of the patient. When they breathe out, exhale, it doesn't go back up here just because of the resistance from the flow. It's a passive system. It'll come up this way to here. Here's our reservoir bag, which needs a scavenger system attached to it, just like the circle system does. The basic principles are the same, and it needs it right there. Hooks in right there, and this goes to our scavenger system here, which has a finite number of hours, and we keep track the date that it was put in, the approximate hours that it's been used. So if you want to use this reservoir bag, which is obviously much smaller because it's used on a patient that's less than about 15 pounds or 7 kilos, we flip this off and depress the bag if we want to give it a breath, and turn it back on. So when we're all done with everything, whether it's the non-rebreathing or the breathing circle system, we turn the oxygen off here on this tank, the little E-tanks, and then we want to flush the system out to get the pressure down to 0. So I press the O2 flush valve, and it goes to 0. And that is